Ladies and gentlemen, thank you, Mr. Chairman. I'll be presenting the results of needle fasciotomy in the treatment of Dupuytren's disease. As we all know, Dupuytren's disease is a benign proliferative disorder which can lead to sclerosis of the pulmonary aponeurosis and lead to progressive flexion deformity of the fingers. The mainstay, which is main modality of treatment these days, is fasciectomy. The first treatment was proposed in the 18th century by Henry Klein, who used bisturi knives to divide the aponeurosis. The first results of percutaneous needle fasciotomy was actually described by Lermiox and Debayer in 1980. The aim of our study was to evaluate the results of percutaneous needle fasciotomy. This was a retrospective study. All patients presenting to our department with at least 30 degrees of MCP joint contracture were included in the study. There were 51 patients, 42 males and 9 females. The mean age of the patient was 44 years. We had 57 hands with 79 rays. The mean follow-up was 15 months. Primary outcome parameter was the dash score, which was determined post-operatively. Coming on to the technique, we used 2% lignocaine, which was inserted at the intended site, and we waited for about 5 minutes for the anesthetic to take effect. After that, the contracture was stretched and then divided using a 14G needle, and a complete deformity correction was possible in nearly all the patients. After the fasciotomy, a tiny dressing was applied on the injection site, and all the patients received a specialist night splint, which was devised by a specialist occupational therapist for the next 6 months. All of the patients received once weekly physiotherapy for 2 weeks, and these were carried on with patient-led exercises. Seven of our patients had early recurrence, and all of these required a further procedure done. One of these patients needed a limited fasciectomy. We did not have any other complications. The mean dash score was 25. Comparing our results to the literature, we found that the recurrence rate was less as described in most of the studies. We did not, however, face any of the complications in terms of flexor tendon injury or nerve injuries or an infection. The dash score was a bit higher than compared to the previous studies. As with all procedures, obviously, we found that it had its share of advantages and disadvantages. The main advantage was it's minimally invasive. It's got excellent short-term results and fewer complications. All the patients thought that they were highly satisfied with this procedure, and they thought they had immediate improvement. The disadvantage was that it had early recurrence, which was frequent, but it's still less than 50% as the initial studies indicated. We feel that percutaneous needle fasciotomy can successfully treat MCP joint contractures in the outpatients department. Thank you.